disruption of intercellular communication. During that time frame, the background level of electromagnetic radiation in major cities like Toronto and Washington, D.C. and New York, in San Francisco and Los Angeles. Over that time frame, the background levels of electromagnetic radiation have increased hundreds of thousands of times. Back in the old days, 1999, we were concerned about the near-field plume. Today, the background levels of electromagnetic radiation are so high that high percentages of the population are showing symptoms of electrosensitivity, meaning that they are allergic to the electromagnetic fields. Well, how do we know this? One of the things that we do in our nonprofit Safe Wireless Initiative, www.safewireless.org, commercial, is that we have a registry that we began in 2002. And that registry is the only post-market surveillance registry in the world that tracks symptoms among people who believe that they have symptoms related to electromagnetic radiation exposure. In the time frame 2002 to 2004, beginning of 2005, almost all of the complaints registered by people in the registry had to do with cell phone exposure. They felt that their symptoms were because of their cell phone use. In the past 18 months, 80% of the registrants are complaining of symptoms related to electrosensitivity, and these people don't use cell phones. So that what we have is that the background level of electromagnetic radiation has gotten so high that it's very difficult in cities where there's high concentration of wireless technology to distinguish between near field and far field. So that the near field plume and the background level are coming so close to each other. Now remember that what triggers the biological protective response that is the culprit in all of this are the information-carrying secondary waves that are on top of the megahertz frequencies. How come those background levels are so high? Well, it's because people in communities have gone wireless crazy. You have entire communities now who are going wireless. All of this information-carrying wave network raises the background level of electromagnetic radiation to the point where we're triggering the electrosensitivity. Now here's what's worse, if it could be worse. So what happens is that when your biological cell membranes, brain, blood, nerve cells, are continually bombarded with this information-carrying exposure, the cell membranes become imprinted with information that says they are under siege. It turns out that the cell membrane is actually much more important in determining genetic makeup than was previously thought. Now, when you have information on the cell membrane that's imprinted that says that we're under siege, that information on the cell membrane changes the way messenger RNA inside the nucleus of the cell folds. And when the messenger RNA is changed, the message that it carries to the nuclear DNA is changed. And when the nuclear DNA message is changed, when that cell goes through mitosis, creating daughter cells, the new information goes with it. So the damage that's imprinted on the cell membrane in cell 1 is carried on to daughter cells and daughter cells and daughter cells. That is the mechanism of electrosensitivity. One thing that we do in the Safe Wireless Initiative is try to identify the best places for us to use our public health resources to solve this type of problem. One of the tools we use is something called an epidemic curve. Now, an epidemic curve is a standard public health tool. And the purpose of the epidemic curve is to identify where to target resources for public health intervention. And about 6 months ago, we began constructing monthly epidemic curves dealing with risks from electromagnetic radiation exposure. And we base the epidemic curves on published peer-reviewed studies only. Published peer-reviewed studies, primarily epidemiological studies. And with regard to cell phones, there have been 28 of them published now in the open literature. Incidentally, every one of them, every one of the studies shows some evidence of an increase in the risk of tumors. Now, the epidemic curve tells us the number of new cases of disease that are directly attributable to the exposure. Our epidemic curves say that in 2006, in the world, there are somewhere between 40,000 and 50,000 new cases of brain cancer and eye cancer directly attributable to cell phone use. By the year 2010, the epidemic curves say that that number will rise to between 400,000 and 500,000 new cases of brain and eye cancer directly attributable to cell phone use. By the year 2015, 1 person out of every 4 who uses a cell phone will have a symptom directly attributable to the cell phone use. In our history, we have never had anything that produces these types of numbers. Nothing. Now here's the real bad news. I know, I get this Grim Reaper response all the time. Why did we invite this guy? The real bad thing is this. The studies that produce the data in the epidemic curves are published studies that are telling us what happens to adults using cell phones in the 1990s for between 500 and 1,000 minutes a month. Because that's all the information that's available. We did a study in Buffalo, New York, in the end of 2004 on teenagers. And what we found was that the average teenager in Buffalo uses a cell phone 2,600 minutes a month. Some kids use the phone 7,000 minutes a month. When you take 500 to 1,000 minutes a month, then you extrapolate that forward to 2,600 to 7,000 minutes a month. That is what drives those epidemic curve numbers. And the bad news is that our children and our grandchildren are the people in those curves. So we have embarked on a grand experiment with our kids. Now the good news, it's coming. Okay. I keep building it up. I mean, it is encouraging that there are things we can do because we understand now. In the past year, we have doubled our knowledge in terms of how these mechanisms work. We've doubled our knowledge in terms of how these mechanisms work. So that if we understand, for example, that the triggering mechanism is protective biochemical responses at the cell membrane level, and we understand that disruption of intercellular communication is a big part of the problem, then it gives us an opportunity to target those mechanisms with interventions to prevent the realization of those epidemic curves. Now, we have a construct that we follow in the Safe Wireless Initiative called the public health paradigm. And the public health paradigm has 3 layers or 3 levels of intervention. A primary intervention is an intervention that prevents the exposure or prevents the cause of the problem. A secondary intervention is an intervention that minimizes the effects or deals with the symptoms. And a tertiary intervention is an intervention that allows us to repair the damage. And luckily, there are technologies available that are primary, secondary, and tertiary interventions. An example of a primary intervention is use of a headset. Because if you use a headset, then you're able to move the antenna away from your body so that you're not exposed to the near-field plume. It's a primary intervention. Now, as it turns out, it takes about 30 seconds for that recognition by your cell membrane of the electromagnetic field to occur. So that means if you're carrying the phone on your hip and the phone rings, you've got 30 seconds to hook up your headset so that you can move the exposure away. Now back in the old days, 1999, we thought that that was enough. But as it turns out, with the background level of electromagnetic radiation getting so high, if you use a headset that's wired, or if you use a headset that is like a Bluetooth headset, a wireless headset, they act as an antenna that attracts ambient electromagnetic radiation. So that's why myself, I use a type of headset that is an air tube headset. Air tube headset. It's like a stethoscope. And the sound travels through air between the microphone and the ear. I've been using this since 2000. Back in after the World War II, we became, after Hiroshima and Nagasaki, we became very interested in the idea of guided missiles, because you could then send the missile far away across the ocean and then press a button, and then it would blow up over there and you wouldn't get hurt by it. And what would detonate those munitions were radio waves. Now, if you have stray radio waves on a ship and you're carrying a bunch of bombs and they set off one of those bombs by accident, you have a problem. So, of course, our military's smart. They figured this out.